Hi, and welcome back to my channel. So if this is your first time watching, welcome. And if you're a returning viewer, don't forget to comment, like, and subscribe. So today I want to talk about nursing strikes. So first I'll go over what they are, and then I'll go over what can cause a nursing strike, my experience with nursing strikes, in some ways or some solutions to help during a nursing strike. So first, what is a nursing strike? So a nursing strike is when a happily breastfed baby suddenly doesn't want to breastfeed anymore. And there's a lot of reasons why it can happen. So you just kind of have to do like process of elimination. So some causes of a nursing strike is mobility. When your babies get more active, so say like when they're getting to the age where they're starting to sit up or starting to crawl or starting to grab things with their hands, that can cause a nursing strike. Another factor could be distraction. It's just they're getting a little more alert. They're not as sleepy as they used to be, like when they were newborns, and so they're distracted while they're breastfeeding. Another cause could be teething, sore gums, so it could hurt when they're breastfeeding. And that also another cause could be a toothache. An ear infection that can hurt. The sucking motion could hurt while they're breastfeeding. And then another one could be like a change or stress. So like a change of environment or maybe stress that the baby is responding to can cause a nursing strike. A new pregnancy, because that changes the way that the milk tastes. A growth spurt, and also when the baby, when the mom is returning to menstruation. So when she's getting her cycle after birth. All of those factors can lead to a nursing strike. So you kind of have to figure out where your baby is. And if you know your baby, then you'll be able to pinpoint maybe it's this thing and you can adjust, accordingly. For my first child, my daughter, when she had her nursing strike, she was about 9 months old. And hers lasted a few days. And I remember just going online researching because, we were fine with nursing. Nursing was going beautifully. And then all of a sudden she didn't want to nurse. So for her, it was distraction. So I had to like physically remove her from, say if I was like in the living room watching TV or something, or I had people over, I was talking. I had to take her to a quiet place, usually dark, where there was no noise, no sound, no nothing. And she would eat. It was over in about a few days. It didn't last really long. And she was fine. With my second child, with my son, his lasted a while. His lasted a week. And his was brought on by a few things. So for him, he had his nursing strike when he was about 6 months old. And his was like, and the way that I got him to nurse was, he wouldn't nurse at all. Like he would be crying. He just refused to breast outright. And so I had to actually figure out that the best way to nurse him was when he was asleep. So like whenever he fell asleep, like that early stages of sleep, I would lay him down on the bed and we would side lie position and he would nurse that way. It was just something about him being awake. He was like, I don't want to sit down. I don't want to breastfeed right now. And so that's how I got out of his nursing strike. And also I had newly found out that I was pregnant and we had moved. So it was a lot of factors for him that led to his nursing strike. And that's probably why his lasted so long. But it was fine. After a week, he was back to nursing normally. And then for my son Kenzo, I just went through his nursing strike and his was just a couple of days. Nothing crazy. I could kind of tell that it was coming on because he would eat, but he would be distracted. So I was like, okay, I was just on the lookout for it. So his happened when he turned 6 months as well. And for him, what worked for him was changing positions. So I normally breastfeed him in a cross cradle position, which is like this. And so just changing positions worked for him. So I just changed to the football hold. And for some reason, changing that position from the cross cradle to football was the trick that worked for him. But some signs of a nursing strike would be refusing to breast, arching the back, and crying at the breast when you're trying to breastfeed. And this, like I said, it's a baby where you normally have a good breastfeeding relationship. It's been established. There's been no problems. And then just all of a sudden they don't want to breastfeed anymore. So all of those causes, the mobility, distraction, teething, maybe a new pregnancy, the return of your cycle, a new pregnancy and a return of your cycle, that changes the way your breast milk tastes to a baby. So sometimes they may not like that change. And it just takes some adjusting for them to get used to, you know, to the way your breast milk tastes during those 2 time periods. And that could bring on a nursing strike as well. But they're very temporary. It's really nothing to be worried about. So some solutions would be changing positions. That can work. Keep offering the breast as much as you can, probably a little bit more often than you normally would, especially if they're not breastfeeding at all, if they're refusing the breast completely. Skin to skin. Of course, if it's been a while since you've done skin to skin with your baby, just bare chest to bare chest, just even that little bit of change can help, and they'll be more willing to breastfeed. Hand expression. So like just hand expressing some milk into a cup, or using a syringe. Like if you've hand expressed into a cup, you can do it that way. Also pumping or using a bottle if your goal is still to breastfeed, to get the breast milk any way you can. And it's almost always temporary. So if you're worried about your baby getting enough food, enough calories, enough nutrition, if they're at an age where they can eat regular food, then you can do that. You can give them a little bit more purees, or the baby rice cereal. You can do that. Either of those 2 things, if you're really worried that they're not getting enough breast milk that you would like them to have, you can kind of supplement that way until the nursing strike is over. And just remember, don't take it personally. I took it super personal when I went through the nursing strikes, more so with my second, because his lasted so long. And I was like, what's wrong with me? Why my baby doesn't want to eat? And it was just like, so just try to stay calm. I promise you, it's usually not long, and it's not an indicator that your baby is ready to wean. If your baby is under 1 year old, they still need breast milk and they still need formula as their main form of nutrition. So it doesn't mean your baby's ready to wean or stop breastfeeding. If it's still your goal to breastfeed past the nursing strike, just be super consistent, and just try to offer the breast whenever you can. And usually it will be over not too long. But yeah, that's a nursing strike. Those are some of the signs. Those are some of the causes that can bring on a nursing strike. So just stay positive and try not to stress out too much about it. I promise you, it's not a long thing. You just kind of got to wait it out. Baby gets used to things. You get used to things. And hopefully it should be over. So be encouraged if it's your goal to breastfeed past this nursing strike. Okay, so that's all I have today about nursing strikes. Hope you enjoyed the video. Don't forget to comment, like, and subscribe, and I'll see you in my next video.